Most Triad students head back to school a week from today. Many parents have opted not to get their kids vaccinated against COVID, even as spread remains in the highest possible category in much of the Triad. All right, so now's a good time to review COVID vaccine guidance for kids and more. To do that, we have Dr. Suresh Nagappan with us. He is the medical director for the children's unit at Moses Cone Hospital, and he's reviewing pretty much everything you need as a parent to know to keep your child COVID-free, if we can, in this school year. All right, so doctor, let's talk about this. Can kids get COVID vaccines at the same time as other vaccines?
Yeah, well, thanks for having me. I'm glad to be back. The answer to that is yes, they can. So you can get the COVID vaccine the exact same day as any of the other vaccines, including the flu shot. So that kind of makes it easier on parents. You don't have to go back and forth multiple times. So usually when you get to the office, they'll give it a different site, but you can do it the same day.
Okay, that is good to know. All right, so how long should parents wait to vaccinate their child if they recently recovered from having COVID?
Yeah, good question. There's not a specific time for that, not a specific recommendation. At a minimum, you want to wait until you are out of isolation, right? So, and that's just because you don't want to infect all the people giving you the shots. But there's actually some interesting data that shows that, maybe waiting 2 to 3 months is the ideal time after getting COVID, because that's when your immune system is going to have the biggest bump. And then you have the benefit of, if you just had COVID, usually you're fairly well protected, for 2 or 3 months. And so you have that little window until you can get the shot again. So that's probably the ideal time to do it.
Yeah, that would be right around like almost that Thanksgiving, Christmas break-ish time if your kid had it over the summer. All right, so some parents argue that kids, they don't get, as seriously sick with COVID, so they don't really need the vaccine. And if that is the thought process out there, what would you say to parents who are thinking that way?
Yeah, there's plenty of people who think that, and I totally understand that line of thinking. What I would say to that is, it's true that kids get less sick than adults, but it's not never sick. And that's a really important distinction, right? Because even here in Greensboro at our hospital, we've had about 200 kids who've been admitted for COVID, specifically for COVID. And that kind of excludes all the kids who came in with, COVID was just incidental, right? They broke their leg and then they happened to get COVID. So taking those away, we still had about 200 kids who were admitted just because of COVID. And that's not nothing. That's still a fair number. And so, we as pediatricians, we're just looking to make sure that no one has to end up in the hospital and be stressed out with their sick child. If there's something that you can do that's relatively simple and straightforward that can prevent that from happening, I think that's ideal. So the other thing I would tell people is, in addition to what can happen like right away from COVID, with kids, there's one thing that we probably worry about the most, and it's called MIS-C. And what that is this inflammation that you get. Usually it's like a month to 2 after you've had COVID. And it's inflammation all throughout your body. It's inflammation around the heart, can be the lungs, can be really anywhere. And those kids can get pretty sick. And some of those kids end up in the intensive care unit. And that's what we really want to avoid, those cases. Now, it's rare. And what I tell everybody is no one should be losing sleep over COVID in kids. It's, the serious side effects are rare enough that you don't have to be that worried. But you should be worried enough to want to prevent it from happening. And so now we've got these vaccines. They're out that have been approved now from age 6 months and up, all the way to 18. And there's a subset of parents who, they're more of the watch and wait kind, right? They don't want to be the first people to go ahead and get it. And I would say to that, what I would say is, now that we've had all these months and, in some cases years of experience with the vaccine in kids, we've seen that, over 1 million kids of under 5 years have gotten the vaccine. 10 million kids from 5 to 11 have gotten the vaccine, and 18 million kids over 12 have gotten the vaccine. It's a lot of millions of kids, and all those kids have been carefully watched. We have not seen, very serious side effects.
All right, so what about this? Because I know so many of us have seen many vaccinated people and vaccinated kids still get the virus. And so there may be some parents out there who go, okay, well, people who get the shot get the virus anyway, so why should I sign up my kid for the shot?
Yeah, that's a good question. Part of that is, in the beginning of this pandemic, those shots were amazing. They were stopping, 90, 95%. As we've gotten more variants, that number has gone down. But what we really care about is not so much that you don't get any symptoms, but you don't get severe symptoms. And by severe, I mean severe enough so that you end up in the hospital. So that's what we're really focused on. We want these vaccines because it keeps kids out of the hospital. That is the benefit of them. And so, you still may get COVID, you still may have mild symptoms. That's okay. In comparison with the seriousness of being in the hospital. So that's what we're really focused on, is how do we keep kids out of the hospital.
And you said there were 200 kids in the hospital with COVID.
200 kids since the beginning of the pandemic. We've had 200 kids in the hospital. So that,
Okay.
I'd love it if we never had another one. That would be
Right.
best news.
So a big concern for parents are the side effects when the kids get the vaccine, right? Like nobody likes to take their kid to get any kind of shot, right? Because the kid doesn't like it and there's crying involved and whatever else. But there are some side effects, just like us adults had side effects. Can we kind of go through the breakdown by age group of like what those side effects might be for kids so that the parents can be fully aware of what's happening?
Yeah, I think it's really important. If you're gonna give your kid a vaccine, you should know like all the side effects. You should know what you're getting into. And so the side effects vary a little bit by age. So for that younger age group, under 3, they tend to have pain just like older kids and adults have pain at the site of the shot. They can be kind of fussy. They can cry sometimes. Sometimes they won't feed as well for about a day or two. Sometimes they'll be a little more sleepy for that day that they get the shot. But all that stuff is pretty short-lived. And after that, they tend to do fine. For the older kids, 4 and up, very similar side effects that what you may have experienced yourself if you got the shot. So again, like pain and soreness at the site, you can be tired, you can have muscle aches, sometimes you get some swollen lymph nodes, and sometimes headaches. So those are the very similar symptoms to older kids, teens, and adults. Those all look very similar. You should know that there are some rare side effects. So I think it's important for people to know that too. The one that we've kind of been keeping our eye on is something called myocarditis. That is something where you get inflammation around the heart. It's incredibly rare. So there was a study that looked at 18 million people who got the dose. These were like older kids, teenagers, and there's only 20 cases out of those 18 million. So it's it's like a 1 in a million, like get hit by lightning kind of risk, but it's there, and we still want people to know that. To me, it's so rare that it's not going to stop me from recommending the shot to patients or for my own kids. I certainly got them vaccinated too. So those are sort of the rare side effects that we talk about. The other thing that people are definitely talking about that does happen is some changes in menstrual periods for young women. It can happen. It usually is pretty transient. And what we see is that it has no effect. The shot has no effect on puberty or development or anything else down the road. So again, it's very short-lived, and no one has had really major issues with that for the long term.
Okay. All right, so COVID is one thing. So often, though, kids bring home a bug from school, right? I mean, we've all been at norovirus, whatever else they got going. How do families with kids stay healthy?
That's a really good question, and especially this time of year when kids are going back to school. That is just a lot of bugs out there, a lot of changing of bugs. So there are a few simple things you can do. So one is, like we said before, get vaccinated, and so that includes the COVID vaccine, but includes all the vaccines. So make sure you're up to date and your kids are up to date. The second thing is wash hands. That simple thing makes a huge difference. And so especially soap and water is the best, especially for those GI bugs. But hand sanitizer works for COVID as well as other respiratory infections. So that makes a really big difference. And that's just a great way to stay healthy.
Mm-hmm. Okay, yeah, wash those hands. Everybody, wash the hands before, as soon as they get in the car, it's like a squirt of something or whatever. All right, this is your chance to ask your doctor your questions. You can text that question to 336-379-5775. Now, your questions are anonymous, but you get your question answered in real time. That is why the expert is here with us until 6 o'clock. Again, 336-379-5775. We'll be right back.